Next we're going to hear from Nicole Hemingway, CEO of US Pain Foundation, and a colleague on the results of a survey that we at US Pain Foundation conducted and released on September 1st in coordination with Pain Awareness Month. The title was Understanding the Barriers to Multidisciplinary Care. And I think there were some really interesting findings that Nicole's going to go over. So welcome, Nicole.
Yes, thank you, Cindy, so very much. And good morning, everyone. I am just really glad to be here today. This symposium is tackling a much needed topic. And I am honored to be able to bring the patient perspective to everyone tuning in and to discuss our recent survey on barriers to pain care. Next slide, please. First, I thought it would make sense to share a little bit about the US Pain Foundation. So US Pain is the largest national nonprofit for the chronic pain community. And our staff is primarily comprised of people living with pain, which means that we are deeply invested in helping patients. Next slide, please. We strive to help individuals through our various programs and services, the large majority of which are free. Our programs, listed here on this slide, range from a national network of support groups led by a clinical social worker to federal advocacy efforts that include representing the patient voice on high-ranking policy committees. Next slide, please. So one of our primary focuses is advancing multidisciplinary pain care. And to better understand the barriers that patients face in accessing this type of care, which, as we all know, is best practice, the organization recently conducted a 57-question survey as part of our Pain Awareness Month initiatives. Over the course of a week, a total of 1,581 individuals with chronic pain responded. Next slide, please. By far, as you can see, the large majority of respondents were female, white, and over the age of 45. Some of these results might be expected. After all, women and older individuals are more likely to experience pain. But that doesn't necessarily account for them being such a significant majority, or even the underrepresentation of people of color. So an interesting area for future study could be why some populations are more likely to seek assistance from patient groups and how patient groups can better connect with and support diverse communities. Also worth noting is that the majority of respondents indicated having Medicare, which I will go into detail on the next couple of slides. So next slide, please. One item that we found promising overall was that 96% of respondents reported to having some kind of insurance. Most indicated having Medicare at roughly half, followed by insurance through an employer or a family member's employer. A little over 12% had Medicaid. Interestingly, for those with private insurance, Blue Cross Blue Shield was the leading insurer at 45%. Next slide, please. So the reason for such a high rate of Medicare is likely that people who seek us out are typically severely impacted by pain. Nearly 3/4 of respondents reported living with pain for over a decade, and 82% of them considered themselves disabled. In addition, nearly half of the folks reported they received Social Security disability insurance, which makes them eligible for Medicare. So it's clear that the patients we try to serve are among the most vulnerable in our healthcare system. Next slide, please. Patients reported experiencing pain from a large range of reasons, but most reported living with musculoskeletal conditions at 81%, followed by neurological conditions at 70% and rheumatological conditions at 53%. Interestingly, there were 45% of respondents that said their pain was a result from a trauma or injury, such as a car accident, and 29% live with a rare disease. Next slide, please. The findings from this survey really align with what we as an organization hear every day from patients, and that is Although experts agree that the best pain care is multidisciplinary, multimodal, and individualized, patients don't realistically have access to that type of care. Here are our 4 key takeaways, which I'm going to discuss in detail over the next few slides. Next slide, please. By and large, patients do not have access to multidisciplinary care. Despite their severity of pain, only slightly over half reported being seen at a pain center. And nearly a third said they cannot see a pain specialist as often as they like due to barriers to cost. For those who do receive care at a pain center, an astounding 77%, over 3/4, reported that the clinic or center only offers pain doctors and not multidisciplinary specialists like psychologists, nutritionists, physical therapists, OTs, etc. This really just illustrates that we're not making multidisciplinary care as accessible as we could be. Next slide, please. Another finding that we found interesting was looking at what patients wanted most emphasized versus what they perceived to be most emphasized by their providers. While providers typically most emphasize medications and interventional procedures, patients actually wish they placed the most emphasis on complementary or integrative health approaches, as well as restorative therapies, followed by medications. Again, this tells us that folks want to have their pain managed comprehensively, but providers aren't necessarily able to offer that, whether it's because of a lack of time, resources, or training. Next slide, please. So of all the barriers we explored in our survey, including knowledge of options, concerns about side effects versus risks, geographic location, insurance issues, etc., direct out-of-pocket cost was by far the largest obstacle. Over 3/4 indicated cost prevented them from accessing one or more treatment options. In addition, nearly 52% stated that high copays prevented them from accessing treatments. Cost aside, insurance limits and requirements present barriers to patients as well. Next slide, please. So this graph lists the treatments respondents most commonly couldn't access because of cost. Complementary and integrative health approaches, as well as restorative therapies, lead the pack with massage at 53%, acupuncture at 39%, and physical therapy at 29%. This does make sense though. Massage and acupuncture are rarely covered by insurance, so those costs are typically entirely out of pocket for patients. In regards to physical therapy, it's possible that even though copays per visit may appear affordable on the surface, over multiple visits, which someone with a chronic illness most likely will need, the financial burden adds up and they are unable to afford it. Next slide, please. For the 96% of individuals with insurance, we see the results of our questions about cost echoed again. Massage, PT, and acupuncture are the 3 therapies most commonly prohibited by copays, followed by chiropractic care and counseling and talk therapy. Aside from costs, issues like prior authorization and annual visit limits most often presented barriers to accessing physical therapy, massage, chiropractic care, acupuncture, and interestingly enough, opioids. Again, and I know I've been saying this over and over, but it really is worth noting that restorative therapies comprise the majority of answers here. We consistently see these emphasized as integral to effective pain management, and yet patients are struggling to access them. Next slide, please. If there is one silver lining from the pandemic, it has to be the leaps and bounds made in increasing the availability of telehealth. And 90% of patients report they want telehealth to be an option beyond COVID-19. The convenience is vitally important for people with pain who live in rural areas or have mobility issues, as it allows them more options for obtaining care. Next slide, please. I wanted to share this graph to show really the breakdown of mobility issues. Difficulty driving by far is the most common mobility issue our community faces, which obviously is going to cause challenges when trying to schedule doctor's appointments, visit healthcare providers, or even get to the pharmacy. I really think it is important to highlight because even if a patient can afford a particular therapy, perhaps they simply can't get to it. Next slide, please. Finally, the survey shed light on gaps in addressing physical or behavioral health as part of a multidisciplinary approach to pain care. Slightly over a quarter reported wishing mind, body, and behavioral health therapies were emphasized more by their providers. And almost 20% wish they had the ability to see or see more of a mental health professional, but barriers like costs, again, prevented them from doing so. As an organization that provides support groups to patients, we were interested to see that those in rural areas most commonly found their location a challenge in terms of accessing support groups, and not necessarily what we thought would be the most common challenge, which would have been like restorative therapies or interventional procedures. Next slide, please. By and large, the study clearly underscores the enormous gaps between best practices in pain management and the pain care that is currently affordable and accessible to patients. Much more must be done to reduce those barriers to care, and here are some of our recommendations. First, we must incentivize the creation of multidisciplinary pain centers through value-based models of care. If we truly want to improve pain care, especially for individuals with complex and disabling health issues, payments should be tied to health outcomes and not services. Next, we need to improve insurance coverage of multidisciplinary therapies, particularly massage therapy, acupuncture, physical therapy, chiropractic care, exercise programs, and counseling or talk therapy. And this also ties into what Kirk was talking about a little bit earlier. This is both in terms of lowering out-of-pocket costs, but also in terms of rules and limits on things, like the number of visits per year or unwieldy authorization paperwork just to get to the right provider. And finally, we have to provide more education to providers and patients on the value of multidisciplinary care. Specifically, that it is best practice to find the right combinations of therapies for the management of each individual's pain. In particular, we are huge advocates for the national dissemination of the HHS's recent best practices in pain management report. Next slide, please. Thank you guys so much for having me here today. This is a much needed conversation, and we really do appreciate the opportunity to include the patient perspective. For those that would like to read more about our findings from this survey, please look at this link that's on this slide and you can download the report. I'd also like to thank our sponsor of the survey, Sunbeam, and especially the AACIPM for inviting US Pain Foundation to partner on this symposium. Thank you so much. And Cindy, I'll turn it back over to you.
Thanks, Nicole. Great job summarizing a sort of complex report, but the report's available, like Nicole said, so hope you will take a look at it both on our website, and I know Amy's going to make it available as well.